too often.
Yeah.
It's not common, when you speak about breast cancer or diabetes or heart disease. Health literacy is our understanding of that disease. And in South Africa, with our diverse culture and rural, peri-urban and urban areas, we find that the health literacy of our patients is very low because breast health and breast cancer is not always something we speak about. So when you are touched by breast cancer, yes, then you become involved in this conversation because you're either a patient or a caregiver. And with the APIS Award, it's an innovative program. We won a grant, and with that grant, we have developed in partnership with a company called Phytos, the Phylaxis AI platform. And what that does, it sounds like a lot of big words, but basically what it is you go onto a web-based platform and it asks you a whole lot of questions about breast health. For example, one of the questions is, how often do you check your breast? Every day, every week, every month, once a year, or never? And this is educating people. So you answer all of these questions, and at the end of the questionnaire, you get a detailed report about your breast health literacy.
Sure.
So, for example, if you said, I check my breasts every day, it will say, well, the proper way to do it is check your breasts once a month, 7 days after menstruation, and then it will carry on giving you information about start doing mammograms at the age of 40, etc. So by asking these questions and you answering them, you will get a better insight into breast health and the breast cancer awareness that we as organizations in South Africa want to impart on everybody. We find that a lot of women in particular are too scared sometimes to ask the questions.
Yeah.
Or if they have a breast lump, they're scared to go to the doctor, or they delay it until it gets bigger and bigger. And this is, with this platform, the breast health assessment, we're enabling all South Africans to improve their health status and their health knowledge around breast health and breast cancer. So it's an easy way for any South African to go and do the assessment, get the answers, and get the information they need about their breasts and breast health without having to go into a clinic and ask a question or sit in the church and say to everybody in the church, well, ladies, you know what, I've got this lump. What do you think I should do? It's enabling and empowering the women in our country to take that step to increase their health literacy and increase their knowledge about breast cancer and breast awareness. You know, October's around the corner. Internationally, October's Breast Cancer Awareness Month all around the world. And there's always this huge drive in October to do the awareness. The other 11 months of the year, we don't talk about it. So if you do have a problem or you think you've got a problem, this is one way to find out some answers, what you should do, what the signs and symptoms are, and then at the end of the day, reach out for help or go and see a doctor, because effectively early detection saves lives.
Absolutely.
And the earlier you catch a breast cancer, or the earlier you go for screening for any cancer for that matter, the long-term outcomes, it saves lives.
Absolutely. I love the fact that you're bringing, the element of technology, because, I mean, wherever you go, people are on their smartphones, and now you're making it easier for us to be on the smartphone, but also, like you're saying, to ensure that you are health literate, that you are aware of what's going on with your body, because so often we are not. And yes, of course, there's stigmas, attached to visiting the clinic and so on and so forth. And some people have that sort of, I guess, trauma, maybe if things have happened before, or you've heard things and then you think, oh no, I can't go there, what if, so I love it that you are actually making the individual accountable as well, and you're making it as simple as possible with this new technology and innovation.
And it's a safe space because
Yes.
they answer their questions on their knowledge. They're not standing up in a community going, well, I think my microwave is giving me breast cancer. Um, and
Exactly.
people
Yes.
don't want to say these things, but they might think it. So it gives them an opportunity as an individual to sit anywhere they like and do the assessment, improve their knowledge, and find out that breast cancer isn't caused by microwaves. It's just one
Yes.
of those unfortunate
The
things that
myths.
happen to us. Yes, the myths and the misconceptions.
Yes. So, Louise, now looking at the demographics, are there still areas or demographics that you're unable to reach?
So while I was doing this proposal for the APIS grant, I did some research on South Africa as a whole. Now, 85% of our population don't have access to medical aid, so they have to use the public healthcare system. But what I found interesting is that more than 80% of our country have not finished high school.
Sure.
I was blown away by that. I didn't realize that. So when it comes to health literacy from a language perspective and a cultural perspective, these are not things we speak about. There are other more important challenges in our communities and our homes,
Yeah.
whether it is in a rural community or city, that we focus on. And we don't speak about our personal health. You know, a lot of us were brought up, I'm going to use the word old-fashioned, where our parents didn't speak to us about breasts, breast health, sexual health, those sort of things. So it's not part of our vocabulary. And with the many languages we have in our country, there are English words, medical words, that there is no translation for in Xhosa or Sotho or Zulu.
Yeah.
So because there isn't a word for it in your home language, you don't necessarily understand it.
Yeah.
And by doing this project and this AI, all the results will come out in, well, every 3 months we will have results. And in a year's time, we can look at the demographic of our South African women, where they live, what their education level is, how old they are, and the information we get from it. We can change the way women are educated on breast health in our country.
Yeah.
And I think that's the most important thing, because we all do education around cancer. I mean, there's over 30 organizations. But we're doing the medical awareness. We're doing the medical education. And a lot of us don't understand or relate to that because we don't understand the words, or there is no word to explain it in our home language.
Yeah.
And by doing this, we're opening up the doors in the future where we can specifically in the Western Cape, for example, do education from the answers we got in those areas, or we can go to rural and change the way we're educating the woman in those areas to make it more understandable. And I think the most important thing is less scary, because the minute you hear cancer, it's a very scary word. Everybody thinks, oh, cancer, it's a death sentence, you're going to die. I'm a 20-year survivor of breast cancer.
Wow.
The entire Breast Health Foundation team are all breast cancer survivors. We've all been through this journey. And we are testament to the fact that it can be beaten. You just need the knowledge to be empowered and have a structure where you can get support so you can go through this journey.
Yeah. Sure. So there is hope out there, family. For those that are listening, you can write to us on 0817291657. That is the WhatsApp line that we have, that you can maybe share your views or maybe share some of your experiences. Now, Louise, when it comes to sort of the foundation itself, what is still needed? What are the things that you need in order to go forward? And how can listeners get involved or maybe partner or collaborate with the Breast Health Foundation?
Okay, so the first thing is not something that I need as an organization or the Breast Health Foundation needs. The first thing we need is to understand that a woman going through cancer, just be there and support her. Take a meal there. Go and get the groceries. Pick up the kids from school. So someone in your community might be affected by cancer. Just be there to give them a hand.
Yeah.
I think that's the most important thing, because that's what we as an organization strive to do,
Yeah.
is to help people through this journey.
Mm.
And you don't have to donate money to do that. It's always great if you donate, because then we can do more work.
Yeah.
But the thing is, just to understand, your neighbor might need some help picking up the kids from school because she's going through treatment. And for me, that's the most important thing we need in our communities, is that we as women stand by each other and support each other through these challenging times, whether it is a breast cancer, whether it is diabetes, any of those diseases. Just be there to give them a hand. So for me, that's the most important thing. But from a Breast Health Foundation point of view, if you are a patient and you want support, you can contact us on our hotline or our 0860 number. If you have somebody who needs to be referred into a hospital or not sure where to go because they have a problem, give us a call. We can support them and put them in the right direction and navigate them into a treatment center or a care center. And look, donations are always fantastic, because we provide a number of support services, whether it is wigs, the ladies going through chemo lose their hair. A wig makes a huge difference to their self-esteem and confidence. We have knitted knockers, which are knitted breast shapes that the ladies can put in their bras. So we distribute those out to the patients who need them. So there's always somewhere where you can help. It doesn't necessarily have to be money and donations, but you can contact us and we can chat to you individually or as a community and see who in your community can benefit from your help.
Excellent. Louise Turner, thank you so much, spokesperson for the Breast Health Foundation, telling us all things that we can that we can wait for in this month to come. But I loved what you said during our interview and conversation, Louise, when you said it shouldn't be just an October thing. It should be an everyday thing, an every week thing, and every month thing, that we speak about breast cancer, and also ensure that the awareness is getting out there. So I really love that a lot. And yeah, if you could just maybe tell us about the month, I guess. What do you have in store in the month as the Breast Health Foundation?
So our big project is launching this breast awareness assessment. I don't know if you have a WhatsApp line where you can put it out to everybody how to get to it. It's a QR code that you take a photo of and it takes you into a website, or I can give you the link. So first thing is empower yourself during October. We have numerous talks. We do a lot of corporate talks. We do ladies' teas and events where we go and speak to them and educate them and support them where they have fundraisers. So during the month of October, we don't actually host events. We're too busy attending everybody else's events and eating cupcakes. I love October. I get coffee and cupcakes nearly every day wherever I go. But we provide the education and awareness, whether it's corporate. We do webinars where you can join in from anywhere in the country, where we're speaking to oncologists and breast surgeons and psychologists about breast cancer and how to manage that. So there's a lot of things you as a woman can do to empower yourself.
Excellent.
So you can go onto our website. If you have questions and you want to speak to somebody, we speak, I think it's 9 of the 11 languages amongst us.
Wow.
So,
way to go.
Between as well as sign language, we have a lady who does sign language.
Wow.
So if you have questions and you want to speak to somebody about it, phone us in on the 0860-283-343 number. And we will either chat to you there and then, or we'll get one of the team to phone you back if we don't speak Sotho or Zulu, and help you in your own language, because I think that's really important. Because we lose a lot of what we are saying through language, and the context of the language. I speak Afrikaans, but none of my team speak Afrikaans. So if I had to
Mm,
start chatting to them, they wouldn't know what I'm talking about.
at all.
You know, and I think that's what's so important, is to be able to speak to somebody who understands your language and can communicate with you in a way
Yes,
that you understand and makes sense.
indeed.
So we do a lot of talks, we do a lot of events, we do online webinars. We have a team of ladies who, all breast cancer survivors, speak the various languages to support you. Um, so it's not always about what we do in October, it's about what we can help people with throughout the year.
Mm,
You know, October just highlights the work we do,
mm.
but the other 11 months of the year, women out there need help and guidance
Yeah.
and support as well.
Sure. Thank you so, so much, Louise Turner. We really appreciate your conversation with us this evening and your time as well, and to speak about something that's so important to us, which is spreading awareness when it comes to breast cancer, and not only having leaving it for October, but let it be an all the time thing, because a lot of women are suffering and they're suffering on their own. But there are spaces like the Breast Health Foundation that are ensuring, with new technologies now, that we are able as women to take charge of our health. So thank you so much, and may you be blessed. And I look forward to having a word with you again, maybe at the end of October, finding out about how the month has been.
Yes, most definitely.
Thank
Thank
you
you for
so
having me on the
much. Have
show
a
this
blessed
evening.
evening. Bye bye.
You too. Bye.
Bye. Family, there you have it. Louise Turner speaking to us from the Breast Health Foundation. If perhaps you've missed this interview and you're thinking, oh man, I just started listening now, TC, well, it's simple and easy. You can go back to our Facebook page. There is a link there, and the video is there. It's been recorded. You can listen and understand what the Breast Health Foundation is about, and of course, how do you ensure that you are empowered when it comes to your own health literacy. That's one thing that I learned from Louise Turner this evening. We're at about 10 minutes to go until the top of the hour, and coming your way, we've got a beautiful song by Philippine, our very own Philippine. Coffee dates with Philippine. She's saying, "Move mountains, get out of my."